as more and more people are enrolled on Medicaid, our taxpayer dollars continue to go up to pay for all of these people. So the biggest problem is that, it's not necessarily a problem to pay for people who really need medical assistance, but the problem is that there's only one organization through Medicaid that supplies these benefits for Medicaid beneficiaries. And because of that, there's no accountability, there's no competition to remain fiscally afloat, to rein in Medicaid costs, and to actually ensure positive health outcomes are being achieved. So the biggest thing is to switch from just one managed care organization that offers benefits to patients.
And we're talking about community care?
Yes, that is known as Community Care of North Carolina. That is North Carolina's one and only managed care organization. And instead to have multiple managed care entities, also known as comprehensive care entities.
Let's talk a little bit about the money, because I use the number $14 billion. That's astronomical. Explain where that comes from.
Well, the $14 billion, Medicaid is a joint program, so it's funded jointly by the state and federal taxpayer dollars. So about 2/3, actually, of North Carolina's Medicaid program is funded by the federal government. And the problem with increasing as each year the budget exceeds its appropriated amount for Medicaid. So that means that is, and largely, the flaw to the Medicaid system is in a large part due to the open-ended federal match rate. And so, in other words, the federal match rate is the amount that the federal government offers to the state to fund Medicaid. So the poorer the state, in other words, the more federal money it receives. And because there's no fiscal responsibility, states just spend, and then they are expected to be bailed out by federal dollars each year.